recording this and I'm going to be sharing it live on Facebook. So this is COVID-19 interactive session. And we started by introducing ourselves. I'm Dr. Dorian Charles. I've got Dr. Amma who is going to speak next. And basically, this is an interactive session which we are going to be discussing about the effect of COVID-19. How has it been with all of us? And then going forward, how are we plan? What has been our experience? And how do we use this experience to move forward? So Dr. Amma, over to you.
Thank you, Dr. Heidi. Hello, everyone. Good afternoon. Yes, Dr. Heidi has set the scene. No doubt, COVID-19 came and caused lots of disruptions. But as with everything, there's always a silver lining. So we can see now that, COVID is at the level that it is now. It's not as bad as it was in 2020, March, when there was lockdown. So there's hope. We can have hope, but we must always expect the worst. Sadly, I must say this, there will be a next time, because this is not the end of a pandemic or end of infectious diseases. So a disease-free situation is unattainable. There's no way we can ever live without disease. As long as we have humans, we have animals, we have plants, we have the ecosystem, there will always be an interaction between us. And it's this interaction that causes things to happen. So there are viruses, there are bacteria, there are so many pathogens that are resident somewhere and are not doing anything. But as long as they can cross species and jump from wherever they are resident into humans, then something will happen, because we are not their normal hosts. So there will always be disease around. Now, the thing is, the extent at which the disease will come in future is what no one knows. Whether it is very pathogenic, whether it will be so transmissible, or whether it will be a pandemic and go around the world like COVID, we don't know. But I want us to know that diseases will always be with us. So for COVID, when COVID came, there was so much talk about it's not real, it's not true, it is new. I need to tell you that there will be newer diseases coming. I don't know whether people will still continue to say it's not new, it's not real when a new disease comes. People need to understand that diseases will always be with us. We need to trust the science. We need to trust science. Maybe I should say we need to hear science, because maybe if I say trust is a very serious word. We need to hear science. We need to listen to science, because whether we like it or not, science has gone a long way. At the last session, I showed some slides. Sorry for those who missed it. I showed some slides of some diseases that had been with us in the past, but what vaccines have done to those diseases. They have either eradicated them completely or controlled them or brought them to a bearable, a minimum level that we can live with them. That's what vaccines can do to infectious diseases. And with COVID, we can see what vaccine has done. This is not how it was previously. People were dying in thousands, but whether we like it or not, the vaccine has come to bring some control. The vaccine has helped. Dr. Heidi just spoke about how she had 3 doses of this vaccine, but she still came down with this COVID. But do you ever think, what if this vaccine was not there? What if she didn't have any of the doses, or even all 3 doses? How devastating it would have been. So vaccines have come to help. They have reduced the number of admissions in hospitals. They have reduced deaths. They have reduced transmission. Nobody ever promised when these vaccines were being made to say that it was the ultimate, and with vaccines, our problems are solved. No one ever promised that. What they said was it was going to help, and we are seeing it. It is helping. So science is very important. And now that we have data and we have softwares that can help us to predict how a disease will be, how it will spread, I think science has gone a long way. And this is one thing Bill Gates was trying to explain in one of his videos. If we remember, I think it was 2019, just before the pandemic came. He was trying to explain to people that we need to trust science because there will be pandemics, there will be this. This is not because Bill Gates is a scientist or a doctor or anything. No, it's because he works with people who know. He works with doctors. He works with scientists. So they give him information, and he's not someone that will just sit down and fold his arms when he knows that there's going to be an issue. He works. So the scientists were giving him data, and it's this data that he spoke on. And what did people do? People tagged him Antichrist. This is just because he was saying the truth about what will happen. People termed Bill Gates Antichrist. But Bill Gates was trying to tell us, look, when these things come, we need to be prepared. There's something called preparedness. He was preparing governments. He was preparing people. But we were ignoring him and people were calling him Antichrist. So what am I saying? There's data available. With data, scientists can do a lot. They can predict. It's data that makes them tell us that, well, the prevalence of COVID is going to be so percent here. It's data that makes them know that the R naught, which is how the disease can be transmitted from one person to 2 people and to 4 people, is data that helps them to tell us this is how bad it's going to be. Is data that helps scientists to tell us, look, 2 households is enough. If 3 households meet, then it's going to be devastated. It is data that makes them say that. Where they say that, and there are other factors that make it not to happen. For example, politics. And that's another thing. We should not mix politics with science. Because if scientists have done their research and they've seen that, okay, with 2 households meeting, it's fine. But they bring it to the table to the lawmakers. It's the lawmakers that put it out there. The lawmakers will say, no, if we do only 2 people, or maybe 3 households, no one's going to vote for us. No, so let's make it 4 households, But scientists have done their job. But politics is there because people want to stay in politics. They want to be voted in. So they give the good numbers. And I'm not saying this is always the case. But what am I saying? I'm saying that data is there to help us and guide us. So we need to trust science more. Look at what happens. For example, when we have issues, let me say we have a legal issue, we run to our lawyers. The lawyer will tell us this is what you need to do. In fact, we'll even bring out evidence that was not even asked just because we want to protect her. Let's say we have, sorry to use this as an example, maybe a divorce problem or problem with your mortgage. You're going to invite your lawyer. Your lawyer will tell you the details of what to do. You will listen to your lawyer. You will dot the I's, you will cross the T's. Let's go to finance. If you have any financial issues, you'll be looking for people who can talk about credit card, people who can tell you how the interest is going to be good if you go this way. We listen to those people. But when it comes to science, when it comes to health, and your doctor tells you, this is it, everybody says no. Nobody wants to listen. We listen to other people, but we don't listen to doctors. Everybody becomes a doctor. For this COVID vaccine, I saw it. Everybody became a doctor. Everybody became an expert in COVID. Nobody wanted to listen. Why do we listen to others, but we ignore the people who know the facts? Everybody wants to be in charge of their health, but you didn't go to a health school. Just like you didn't go to a law school, but you listen. So we need to trust the science, because it is not just that people wake up and say, this is it. I'm telling you that there's data, there's softwares that can simulate, that can make models, that can predict things and tell us this is not the way to go, or this is the way to go. So science will do their part, but other people, conspiracy theories people, politics, media, they all come into play and cause confusion. And that's why there's so much confusion, because there's so much information. There's a true information, but there's adulterated information. There's information that has been infiltrated with greed, with lots of things, and people get confused. They don't know what to do. And knowing us as BAME people, we don't look for answers. We don't do research. We don't ask questions. We just take everything hook, line, and sinker. We just take everything that we hear, but if you calm down and listen to all the sides you want to listen to, the good side, but think which one makes more sense. And if you don't know, there are people you can ask. Always ask. always ask. So what I'm trying to say today is we cannot ignore science. It has come a long way. It has done so many great things. You know, so this is a lesson that we need to learn for the future. So maybe I'll stop now so that people can talk and I can continue to share more later. Thank you.
Thank you very much. Thank you, Dr. Amma. That's really, really informative. Science, we cannot separate science from God. I know a lot of us, the BEM community, we are very religious people, but we cannot, I always say to people, God is science. It's God that gives all the knowledge. Without God, we don't have any knowledge. Nobody will just wake up and say, it is my knowledge. There is a supreme being that actually gives us this. He said he made us in his image, meaning he has put in us what he wants us to use to dominate the earth, to overcome illnesses, to overcome challenges and diseases. So when people come up with answers, that is actually God working on our behalf, and we shouldn't ignore that. So I want to open the floor. We have doctors here, we have mental health specialists. I mean, I want us to talk about various parts of this effect. The people who don't believe in vaccine, if you are able to speak out, we are here. You just say your point. As Dr. Amma said, the data are there. If you have data, if you have proof that, look, this is what's happening, or you've had vaccination and you are thinking that you're suffering with effect from that, please there's a chat box here. You can raise your hand. I will call you to speak. This is an open forum. There is no judgment here. Nobody's judgmental. We are all here to help ourselves. Please do not feel like laid back or that like holding back information. If there's anything you want to share, please share it. You had emotional challenges, you had ill health, or you've had someone who has died and you're just wondering, okay, well, where do I go from here? This is the place to share it. If you have anything to share, please just put your hand up and I will call you up now to share anything. Okay, Lina.
Okay, yeah, thank you for giving me an opportunity to speak. It's my first time on your forum. Yeah, I suppose I'm just I'm really just going to share an opinion in the sense that, as I would say, I thank God that I've survived and kind of almost seen like the full circle of COVID. I have lost some very close loved ones too, but I'm not going to focus on that today. It was just in terms of, yeah, a lot of the decisions are not always based on the science. I mean, a lot of decisions can be a bit political, but I suppose you have to just sometimes use your common sense. But yeah, it was interesting that in December, I too caught COVID after 3 vaccinations. And I did say to myself at the time when not feeling well, my God, what would have happened if I didn't have the vaccination? Because yeah, at the time you're very worried, and it's a mental health issue in a sense that because you've got it, you feel you can't go anywhere. You feel quite isolated and you're just hoping that you just kind of get through it and thinking, gosh, am I going to have to call the ambulance, etc., etc. But having caught it in December, made me realize that if we didn't have lockdown in the previous time before the vaccination was there, yeah, I can see how it was bad. And I suppose when they make those political decisions about to not put us in lockdown because the vaccine is around, it does seem a shame that some people don't make the most of it. But again, having watched some TV programs, I suppose you can't believe everything you watch. I can see why some African Americans, why some Caribbean people are not keen on these vaccinations because of what's happened in the past. And also some of the things I saw about what happened in the Asian community. So yeah, that was just really expressing an opinion. Okay, yeah. Thank you for listening. Yeah.
Thank you so much, Lina. That's really, really helpful. I think for me, I said the same. I said to my family, if I didn't have the vaccine, probably I would have ended up in ITU because I was really, really ill. At a point, my GP said, you need to buy the oxygen probe. I'm like, oh my God, here I go. But I survived the COVID, and you survived thanks to our vaccination, and we're here. So thank you so much. Iro, it's now you to speak.
Thank you, Dr. Heidi. Mine is more of a question. Well, also my personal experience. I also got the COVID. My wife got it, and then I got it. My question is, what? Okay, let me say it this way. Two phases of my question. What is the effect of the COVID on, especially is there any difference as it affects the Blacks compared to the other races? And second question is, after the COVID, I realize it plays a little bit on memory and fatigue. It's like there are some things, just simple names, sometimes just struggle to remember them. And even till now, this is already, I think I got COVID more than a year now, if I'm not mistaken, and I still struggle with sometimes fatigue, just climbing steps, sometimes I lose breath and things like that. How do we deal with that? Is there any medication or any treatment or any exercise one has to do?
Okay, Dr. Wulia, do you want to answer that?
Good afternoon, everybody. I think I'll go through your question. The first question was, is the effect of COVID on BME different from the whites? Like we all know, a lot of BME have underlying medical illnesses that have not been diagnosed. And that's why when they ended up getting COVID, some of them ended up dying, some ended up in ITU, because there's been a kind of linear relationship between effect of COVID and underlying medical problems. Most of the people that died initially, most of those that ended up in ITU had underlying medical problems, which made their immune system much weaker and they couldn't withstand the stress of the disease. While compared to our Caucasians, most of them visit the GP regularly. They get diagnosed with their medical problems, they're on treatment for it. So most of their medical illnesses are well controlled. And then they're able to deal with things like COVID and other viral illnesses, which tends to attack the immune system. So yes, to an extent, underlying medical illness, which most times are undiagnosed in BME, played a role in the effect we saw initially. The other thing you were referring to is what we know as long COVID, which I think it's part of the topic for today. And long COVID,
next week, next March.
Next March, yeah. So I'm not going to go into more details, but just give a bit of clarification. Long COVID just means, you're having symptoms long after your acute COVID illness has gone. People have presented with several varied symptoms. Some people have persistent cough, which can go on for months. Despite all the investigations, it's reassuring that there's nothing acute going on, but it's just that because of the way their body reacted to COVID, they're going to have this cough for quite some time. Some people have complained of feeling tired easily. I think it's one of the commonest presentation we tend to get in primary practice. And a lot of people come in all the time, they're still feeling tired, they get breathless easily. You do all the investigations and there's really nothing acute to account for, things like, low blood counts or another thing that would have accounted for it. So yes, it's most of the symptoms you've just described fits into the long COVID spectrum, and which is something we might not be able to deal with in a day because it's evolving. Every day we keep seeing new symptoms which are presenting. But the good thing is the government is on top of it. We've got long COVID clinics coming up everywhere now. So it's going to be more like a chronic illness at the end of the day because a lot of people will see need support and care going forward from now. So in answer to your second question, most of the symptoms you're having are long COVID, and hopefully next month we would go into more details about it.
Thank you so much, Dr. Chooks.
Can I add?
Yeah, Dr. Amma, go on.
Okay, I think in addition to what Dr. Chooks has said, I would just add that because your question was mostly along the lines of whether COVID affects Blacks more than other ethnic groups. I'll just say for Blacks, and I think we discussed this last month as well, apart from having underlying health conditions that we don't know about because we don't check our health, we also have this poor standard of living. We tend to not take care of our health. We tend to do a lot of things that are generally, we don't control how we work. Maybe I put it that way. We tend to take on so much tasks. For example, when we go to work, we tend to work very long hours, and this is because maybe we want overtime. This is because we have so many responsibilities to sort out back home and even here where we are. So we take on a lot of shifts, and this exposes us the more you're in contact in hospitals, as a frontline worker, even if you work in the shops or wherever, the more you are exposed, the more susceptible the more you contract a disease, really. So our standard of living and our socio-economic status, because whether we like it or not, here we are not at par. We have, there's a lot of, will I say, maybe discrimination when it comes to some things, that we don't have equal opportunities as other people. So we struggle. We have to work extra hard to get what other people who are citizens, would get. So there's a lot of strain on us, and that really affects our health generally. And if our health is affected, we are prone to acquiring other problems, other conditions. Also, especially for Asians, research shows that because we live in multi-generational households, so you don't see like few people living in a home like you see other like white people who just have like a small nuclear family of either mother, father, and one child, or just a mother and a child. We live in multi-generational households. That means I am in this house, I have my mother and maybe my father, so the children have their grandparents and maybe great-grandparents. So there are lots of people living in the same household, and that's overcrowding. And we know what overcrowding causes. There's no ventilation, there's no circulation, so respiratory illnesses are bound to to thrive in those kind of areas. So these are some of the other factors that we as Blacks have that put us as a disadvantage over white people. And another thing I will not forget to mention is the level of vitamin D that we have in our systems. As Blacks, we need to top up our vitamin D more, because the darker your skin is, the less vitamin D you get. So you need to top up your vitamin D level, because vitamin D actually helps you regulate your calcium. And we know what calcium does. It helps you maintain strong bones, and so vitamin D will help keep your system regulated, and it will help protect you against infections, especially respiratory illnesses. So these are some of the factors that we need to consider. Thank you.
Thank you so much, Dr. Amma. Rose, your hands are up.
Yeah, hi everyone. My name is Rose Sally, and I work with Dr. ID. We partner to run events, and this is one of them. I'm very happy to be here, and I'm hoping more people join, because this message needs to reach out to many more people. And for me personally, I've had COVID twice, and the first time I wasn't very, very ill, but what I experienced that time was, because I run a charity and I represent many Black African women, especially first-generation immigrants. And when I got it, the calls I got were, the experience was, they were very annoying. Somebody calls you in the morning to tell us who you've been with, and I'm calling from whatever, public health, I'm calling from this, I'm calling from that. Then you tell them, I've been with 5 people, because we work in a shop. Dr. ID knows. So I gave them all the list, the names and everything. Then they're asking for further information. I said, I think the only information I can give you is the phone and the name. Anything further than that, the owner of that phone, when you make contact, they'll give you the rest of the information. Then after that, another call, asking for the same information. Then another call. So on the second day, I said, listen, I've told you I'm not feeling well. You know I have COVID. I think your collection of information should be from one source, because these are too many calls from wherever, because they're different people. So that was one. And I'm thinking, what if you're an immigrant, like myself, I'm an immigrant who doesn't speak English. You don't have the right to live here. You don't even have enough credit. These are too many calls. So that was the first time, that was my experience. And then there was supporting people, supporting you to work and getting, apparently you could access some money, some funds, but that wasn't accessible for people who have no recourse to public funds. It wasn't accessible to other, undocumented, obviously, and so many other categories of the community. And I'm thinking, I didn't need to access it, first of all. I thank God for that. However, I thought if I was one of them in those categories and I'm feeling well, yet I can still spread COVID, I'll go to work. I'm sorry, I'll go to work because my bills will be waiting. My children will be hungry. So many, many people carried on spreading and are still carrying on spreading COVID because of circumstances. Then the other thing that I thought about in relation to, our mental well-being, I'm part of a partnership called Mama Health and Poverty Partnership. And the reason we started that partnership is to show the link between health and poverty. If you're poor, it impacts on your health automatically. So why is it affecting people like us more? It's because COVID finds a broken body. It finds a broken everything. You're working long hours, like Dr. Amma said. You are feeding your family here and the family in Africa. You are working in the 3 C's, care, catering and cleaning, which are the most infectious areas anyway. And then the living conditions, like Dr. Amma said, overcrowding. If you're renting a room from somebody, there's a few others there as well. Some people, especially, down south, the overcrowding is shocking. Families living in small, small houses. So for me, this is what I've come to conclude. It is not the COVID that kills us. It is the everything else that it finds. Everything else that it finds is what kills you. Then the shock. So that was the first time I was thinking, oh my God, what if I didn't have my family? What if I didn't have friends? Where would I be? So second time round, this Omicron then catches me. How, I don't know. But I found myself with the thing. 2 horrible days. If my daughter hadn't come and found me, she tried to prop me up and put a pillow. I can't explain the pain. And I've had a few surgeries over the years, but the shock I got was everywhere there is a scar on my body was hurting. I can't explain that, but everywhere where there is a scar, that's where the pain was. And my eyes, very heavy. I don't want to see the light. And I'm thinking, what's this? What's this that's happening? Is it? But fortunately, I wasn't the only one who had experienced the eye thing. And there was a few other people. And so that's me personally. That's how that's what I've experienced during COVID. But the most important thing is, the first thing I could worry about, being helpless. I had people, I had family, I have a community, and I had a bit of money to look after myself and my own. But imagine these circumstances that most of the people we work with find themselves in. Over the last 2 years, we've had people who dropped dead, just like that. One of them might be known to you because some of you, because actually 2 of them are from the Nigerian community. He just came back as he was bringing shopping in, very, very tired, just died. It was COVID. It was COVID. So the devastation, imagine the family, the shock. So COVID is with us, but things like this people don't want to listen. Our people, I don't know what you're going to do. We've invited them. We could have easily have had 100 people on here because we've got the opportunity. We've got doctors here who are telling us things that we should. So the last one I was on, I went and bought my vitamin D with zinc and vitamin C. I don't know what it's doing to my body because I trust what you're telling me. Seriously. So our people need to be here to listen because it's for free. But you call people, they don't. So the next thing that happens, telling us how they've been affected. And even rest. You need to tell us more to rest. But people don't listen. So thank you. That's my contribution. But thank you.
Thank you, Rose. I think you really made serious points, even when I'm laughing. I'm sorry. I'm taking vitamin D. I became religious. I became addicted to taking vitamin D every day since December 2019. And recently, because I'm taking the 400 IU, recently I said I will take double. So I'm taking 800 IU daily. Why? Because in December, ending of December, I had COVID, as I said. And since then, Iro was so right. You feel easily tired. You feel like foggy. That's the description he was talking about. Like you want to say something, it's actually there, but what's going on? Like, so I started taking double of that and my multivitamins, which I take anyway. You are very correct. And that's why we are holding, or we will continue to hold the health gospel. I've shared this on live on Facebook, but I think only 4 people joining it. So this is the problem we are having. The challenges we are having is there is information, but where are our people to assess the information? Where are our people to actually listen? Somebody said to me, please just keep an open, let's just tell them, keep an open mind and listen. Nobody's forcing you to do anything. But when you get information, you make right choices. You can then decide, okay, this is what I want to do for myself with all the information I've got. Please just listen. But we have people, especially, that's why I'm an advocate of religious abuse. We have people who are so religiously blinded that as soon as you start speaking about science, about medicine, there is this blockage. They completely black out. They don't want to listen to you. Until something happens, they start running helter-skelter, calling you in the middle of the night. What should I do? How should I? Asking you 20 questions per second. Where do I go? How do I go? Where do I do? Calm down, what's going on? And then it's just like some sort of late. So as you rightly said, there's so much work to be done within our community. And you mentioned something here about the funding for the Black community during the COVID. That's something about something that we as a community will really, if we had forums where we can speak out and actually advocate, because these are the people that were spreading the infection. Because you look at them, I've had a family who said, what can I do? I've got to work. And you're saying, please, 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 you're sick. No, I've got to go to work. And you see them at work, you're saying, please go home, we don't look well. They said, no, I'll manage, because they have to earn this money to pay their bills. So it is it's a concerning problem, and we really have to find ways to see how we can work through in case of, that's why I'm saying ongoing effect. What have we learned? How do we rectify the challenges we have seen? So this is one of the things we have to look into. What if tomorrow, this set of people, how do we help them? So I'm going to ask the, Sister Fola, your hands are up if you want to speak now.
Thank you very much. My name is Fola Alderin, and I'm glad that I could join today. And thank you for this wonderful forum. For me, I would like to speak on, or maybe add to what everyone has said, and maybe chip in terms of our younger ones that we have. when we look at the health disparities that we have across our population, I think it's really, really unfair and unavoidable. It's avoidable sometimes, and it's still really unfair on us. Because firstly, communication of risk to community is really crucial. And, and I think the leaders that we have in the communities hold a very important role, because they always believe that the BAME community listen more to the leaders, isn't it? But at the same time, it is so unfair that most of the way things are run in this COVID era, the blame is being shifted on us most. And we have to rise up on ourselves to say, we've had enough of this. Because I am, when it comes to research, I always say it every time, and I say it every now and then. They always have this thing when they just summarize whatever it is that happened in the that happens in the BM community. They don't really know what it is, but we know better. And it is hard that we put this out as well, as you said, and we have these people that are coming in. But let us talk about what the COVID has done in the past and what it's still doing. If I talk of, the health care and the social care, higher percentage of our people works there. It's either they do care or they do cleaning, because that is where the job is lucrative. That is where they can easily get. But the protection, if we talk about, well, they work a lot, we need to love ourselves, we need to take care of ourselves. We've talked about all the disadvantages, and the advantage of why they work is money. You need money to run this closed economy that we have. I call it closed economy because it just circulates around and it doesn't go. And if you can squeeze to go out, you have to pay for that in the next month when you work. That is when people work extra hours. There was a project that I ran with a friend in London, and I think lots of people have run it too during the COVID. And they were looking at protection for BAME staff. They work in the frontline roles in the health and the social care. And we looked at the outside the health and the care sector. They hold essential jobs. Look at retail. When people were not working, we shouted. There was a lot of video going around. You need to take care of yourself, be careful. But if you look at it, when this COVID started, our people were pushed forward to work extra hours, which they know that definitely they were going to work extra hours because they have no choice. Yeah, they are in the public transport, other sectors putting them on the front line and risk of exposure. Some even reported that the personal experience they had, the report they received from colleagues in terms of the PPE shortages, well, they have no choice. They still have to, renew their homes. Some have to keep theirs because they have to work. However, what are we doing to that? Even if we talk to the health sector and everything, they will tell us that we need to know how to deal with it. If you look at the faith leaders now, they hold a lot of key to our BAME community. What are we doing about that? Are we actually inviting them to this? Are they doing more talk? Because I was in the church last week when our Reverend Father was saying that now they said they shouldn't use masks more and everything, you can, it's a bit free for us to move around now. But it is not left for the faith leaders to know that if you're coming to church, because we as Christians or Muslims, that is the only place we socialize mostly, believe it or not. Some are stuck in the house Monday to Saturdays. I've had ladies that they face a lot of things Monday, but Sunday is the only time they have to even tell you a little bit about themselves. So that is where the percentage of social care that we have, or social, moving around or talking to friends, we see it in religious places when we come together. So what is our faith leaders doing in this kind of situation? They need to be here. They need to know how they can actually, help our people that in church that doesn't understand. Some is because of communication. As Ross said before, You know, they call you. Some, when they see that you don't understand what they say, they won't even go further. If for example, if they call Rose 9, so no English, no English, you will see that the calling would decrease. That is when they send message or they put it on the system that this person staying in so doesn't really understand English. Who is to take the call? None of them will be able to take the call. I've got 2 teenagers, and they've had COVID twice now. They had during last year, they had, and I'm vulnerable. I was really high risk not to have it, but I did because my immune system was so low, and I actually had it, and it was bad. 2 weeks ago, they had it again. I was so scared, but I had no choice because I'm the only one taking care of my kids. The first time I had it, it was really, really bad. The symptoms were there. I had to call. I had to, you know, I was really scared. No one will come here to say that this. But this time I said, okay, I'm going to put it out to them because she was in Duke of Edinburgh, you know, all the teenagers. I had to email the school. We did this. The number of calls that we had about it is a crime if you go out. Can you give us the numbers? And this is the risk. And this is what scares most people, that they don't want to do. So how do we go forward from that? That is just what I will say for now.
Dr. Loretta, do you want to speak? Thank you very much, Fola. I really, when you were speaking, I was having like goosebumps because these are really, really real problems within our community. You've highlighted like in different ways, and you've also highlighted the faith leaders as the main, like the bedrock of change. But we have a hard time most times because when you approach these faith leaders, they think that you are coming, like you are opposing them. The problem we have with faith leaders is the same that I've explained previously, that openness to learn, because most of them feel they know so much. They are pastors, they are imam. What do you want to come and tell me? The Bible says this and and they look at you as if you are coming to oppose them. But it is a challenge that we are willing to continue to take on, because every of these things affect us, and we have government turning around to blame us because they do not know our innate problems. They do not know our problems. We know our problem, and we are the only ones that can solve our problems. And we know where the problems lies, but we have to find ways to reach out to these people more so we can actually get headway to this problem, because in the next 10 years, we have pandemic again. We're going to still be talking about the same thing. We're going to be talking about people accessing health, people accessing this and the language barrier. And we keep talking about this if we don't make changes today. So Dr. Loretta, please, can you speak?
Thank you very much, everybody on this program. Ladies and gentlemen, you people are doing fantastic. We are doing what a lot more of us should be doing. And the last speaker, our sister Folari, right? He nailed a lot of things on the head. And I'll just sort of build on what they've said. I want to find out from us that are here, and maybe those listening.
Jovia,
Jovia, can you mute yourself, please? Thank you.
How many of us have actually seen other people like us come to talk openly about their COVID experiences? Talk about it without inhibition. Talk about it without restraint. I have not really seen people do it willy-nilly, the way I see my other colleagues. I use my workplace as a small microcosm. And I wonder why. What is it about us as a people that makes us keep in what we should say out and then say out what we should keep in? I really don't get it. We seem to have it the other way around. And I've noticed that life is a bit like you have many children. The one that cries and raises up his or her hands is the one that will be carried. The one that keeps quiet and doesn't show that initial, there must be that initial engagement, that look at me, I'm here. And I think that has been the bane of the Black and ethnic minority groups. A lot of us come here, we don't integrate with the system properly. We don't engage. It's not our fault. Sometimes it's also because we don't have mentors to tell us that this is what you have to do. I tell every Black doctor I come across that when the nurses or midwife tell you, do you want tea? Please accept it. Even if you have to go and pour it away at the sink later, kindly accept it. Because you may not know, but that is their way of saying, can I be your friend? I want to chat to you. I want to get to know you. You decline tea today, decline tomorrow, decline next tomorrow, because you don't really like tea. You miss all the gossips. I'm being honest here. Countries are made and wars are initiated at coffee table, pubs, and different places that you think, oh no, it's not happening there. You then go and sit in church 24 hours, the only time you have, and from church you go to work. Or you are actually missing out on those things that will make you integrate in a foreign land. When I came to the United Kingdom, I always say I had a cultural shock. First of all, I never knew from where I was coming that a doctor could say, I don't know, because you're supposed to know everything. You're like, God, if you didn't know it was, I don't know anything. Or that doctor doesn't know. For those, let me translate. That doctor doesn't have knowledge. But I came here and I was being told it's okay to say I don't know. It's okay to say I'm not okay. It's okay to say I need help. And I think these are the messages we need to take back to our cultural groups and tell people it's okay to talk about those things that are not okay. And COVID is not okay. And having COVID is not okay. It's okay to discuss those things that set us back. It's okay for all of us to share our experiences like we are doing now. And then share our individual solutions so that someone else may then domesticate it. You can't take my solution and employ it, but you may be able to domesticate it to your situation, a third. You may be able to see, oh, this person, and just knowing that somebody has done this before gives you an unusual inspiration.
Yeah.
I always tell Edith Charles, not because she's here, I say she's a source of inspiration to me. I look at Amma and she's a source of inspiration to me. Chooks, it inspires me. Hero, Nkoyo, everybody inspires me. Iron sharpened iron. But instead, what do we find? We chase money, chase money, chase money. And at the end of the day, you spend that money. You spend it, and then you spend it and you wonder where it has gone. It's gone into either litigation because you fell into trouble you would not have fallen into if you sat down and discussed with people who have fallen into those trouble before. You fall into problems that you shouldn't ideally even be in. I've had to solve problems that if people had come to me with it in the beginning, they wouldn't be having it. So for me to summarize, COVID employs, in nature, there are some basic laws of nature. You can't do anything and upset them anyway. If you do, there's a problem. because nature abhors a vacuum. In the Black and ethnic minorities, what are we doing? I will add myself. We are all in churches here. Let us begin to take action. We are all in mosque here. Let us begin to take action. Let us decide now, 21 of us in this group, that we are going to approach our faith-based leaders or our community leaders and tell them, in 2 weeks, I want to talk to the congregation, sir. I know I'm not a pastor. I don't want to stand on the altar. I can stand below the altar. I want to talk to them about topical issues. I want to share my experience of COVID with them, either as a survivor or as someone who manages other people who have had COVID. I'm telling you, they won't tell you no. Sometimes we don't reach out. We are guilty. I've been guilty before. And when I realized this, I said, never again will I be guilty. So please, I'm employing all of us. Like this program today, how many people did we share it to? How many people did we really call up and say, join this program? 21 of us here. You engage with people. That's when you get responses. So please, the next one coming up, let us decide now to take action. 5 people, we will call them and say, this is the link, register, join us at so and so time. And let us try and make it faith-based people in our communities. We need help. We must first of all agree that we need help and admit that we need help. And then we begin to seek out the kind of help and we begin to engage with the system. My sister talked about funding. How many of us even know where they are applying for fund? It's there or it's not hidden. The Asians know it, they're using it. And I don't blame them, I love them for it. We should stand on the shoulders of giants. Hero has this, I don't have it. I should be bold enough to go and meet him and say, Hero, can I learn from you? What is the worst he can say? No. Or he will ask no. Does that kill me? Does that make me shorter? No, it doesn't. So please, within the context of COVID, and even everything, let us know that we are our own biggest obstacle.
Yeah.
Yes, you've been sharing on the platforms, but I'm telling you, it makes no difference because they're all rushing to work. They're not reading it. Call 5 people up, a deliberate way to lure people. Call them up and say, come on, I'm guilty. This week, I didn't call anybody up to say, join this program, but I shared it. But I'm not seeing the places and people I shared it to here. So I'm not exonerating myself. I will leave it here for now. There are a few other things I want to say, but I'll let other people speak. Thank you.
Thank you so much, Dr. Loretta.
Thank you.
You always speak so well. I think it is a sober moment for all of us. We know that we have lots of challenges as BEM community. When we say BEM community, to be honest, I say our Black community, because the Asians, I give it to them. They are doing a lot. I don't know if my sister can hear me. She can share to us. There's something that Dr. Loretta mentioned about funding and about accessing fund. Personally, myself, my sister, we can share our experience because my sister visited me over Christmas, and every one of us, don't know if she's here. She's here, but I don't know if she can hear me. I want her to speak, so let it not be that I'm the one speaking. All of us had COVID in the house.
Yeah.
Okay, and she was supposed to go and back to work, but because we all had COVID, she was the first set in the area. We had 2 batches of COVID infection in the house. So we had batch A and batch B. I was in batch B. So they were the first batch A, all of them positive. I was negative, and I was like, yeah, I've got my 3 vaccines. That's why I'm not positive like you guys. You know, I am immune, and I wasn't even like, you know, I will be fine. But batch B, our own was the worst because all their viral load landed on us. Our own was the worst. But she was supposed to go to work. She couldn't because we had to isolate. I want her to share what ignorance led to. I want her to share it.
Hello, everyone. I don't know. I'm sorry. I'm in the car.
We can hear you.
What happened was that I had to shift that week. I was supposed to come back to London to do those 2 shifts. And when we found out that we were positive, I quickly called in. I was even scared. I said, "Oh my God, they will say I'm canceling shifts." I didn't give them the reason I'm canceling this shift. I just canceled the shift in telling myself, I'm not going to take this COVID to work, so I have to cancel the shift. And what happened was when I came back in January, when I resumed work, someone said, I just mentioned to someone, we isolated, I canceled my shift. She said, did you get paid? I said, no, how can? She said, oh no, even I was isolating as well. The whole of my 5 shifts that week, I've been paid fully. I said, how, why, how? I didn't know anything about it. And she started explaining that if you are COVID positive, you just need to send them the results. And if you had shifts booked, even if it was 10 shifts you had booked, you're going to be paid fully for it. And I was here, even scared of canceling my shift. And I'm thinking, there are lots of things that we are ignorant of, and when you find out, you just tell yourself, even during the COVID, so many things what was going on, and ignorance. If you don't know, you don't know. You're just doing things, and we are not asking to know. I should have called someone to say, or should have called them to say, I'm COVID positive. What do? I have these 2 shifts, and maybe they would have put me through. But I didn't ask them. I was scared to even cancel the 2 shifts. And so yeah, that's what ignorance does. And just recently, one of my friends in somewhere, not London, she tested positive for COVID as well. And she told me, oh, when you had your COVID, did you apply for these funds? I can't remember what the name of that fund is, £500. And I said, no, I've never heard of it. She said, no, you have to do it. I'll send you the link. I said, but I had it since December. She said, it doesn't matter. And if you had registered on NHS Test and Trace, you can still claim for that for your COVID, even with your household. So if it was working groups in your household, they can all claim £500. And I'm saying, oh my God, you not even, because we did our own with the LFT, and my sister was saying, let's go and do the let's go and do the test. I said no. So they won't put us in the system that we are COVID positive. Let's not go. And then I'm thinking, oh my goodness, what has ignorance caused? At least all those funds help, because you missed work, you're missing out on funds, and you need to claim for it. It's not that we are doing it just to claim benefits, but it's something that we're entitled to do it. But because of ignorance, which I know a lot of people are in the same kind of shoe I am, and I was there telling my sister, do you know that this UK, you can miss out on a lot of opportunities because of ignorance. So yeah, that's the story.
Thank you so much. I know a lot of us here had COVID. How many of you knew that if you sent your PCR, you will get money for all your shifts that you lost? How many of you knew that? If you had COVID and you did a PCR, you were supposed to do 10 shifts. You will send the PCR to your job. They are supposed to pay you for those shifts. And if you had COVID and you take time off work, that should not be part of your annual leave calculation.
I knew that one.
Okay, so there was monies if you had COVID. For every member of your household that had COVID that is in a working, like from 18 years, you are supposed to be given £500. Most of us don't have this information. Why? Because we are not talking to people. We are just close. Like my sister said, she was so afraid. Let me cancel my. She said, let's go and do PCR. She said, no, I want to cancel. We are so scared of this system that don't sort of even care about you. We don't know our right, because if we knew our right, we will be bold enough to stand on our right, but we don't even know our right. You go to work, they give you employment letter, you don't read the employment details. You don't read what you are offered and what you can access, because they are tiny print. You don't even bother. You just say, where can I sign? And you sign it and give it back to them. There is employment, what do they call it, on your intranet at work. Do you ever take time to sit down and read it, to know what can be your, what do you call it? What are the things that I can benefit from in this work? But we are so scared, even to cancel shift, we are shaking. And these are things this mindset we need to change so that we can.
Do we know our workplace champions where we work? Are people who are workplace diversity and equality champions? Do we know who they are? This system understands that there are institutionalized problems within it. And that's one thing I like the UK for. And they've created loopholes and exit points for us. But most times we don't even know. We don't engage, we don't exploit. I will not lie to you people. When I first came to this country, I was struggling as a registrar then to cope. My husband was doing a high-end specialty in surgery, and I was also doing a high-end specialty. And I was commuting from Sheffield to Stoke-on-Trent, and I kept failing my exams, my Royal College exams. And one day the professor said to me, you are so intelligent. These exams you are not passing, it's not because you are not intelligent, there's something not right. And I told him, I said, yeah, I think so. And then he said, where do you live? I said, Sheffield. He screamed, you live in Sheffield, you work in Stoke? I said, yes. And you're working full time? I said, yes. He said, you should go part-time. I said, part-time? Is there such a thing? In obstetrics and gynecology, part-time? He said, immediately, you have more than enough extenuating circumstance to go part-time. He made me go part-time. He signed all the documents. He took my hand and said, this is it, this is it, this is it. To cut a long story short, I passed that exam the next time. I was coming from Nigeria where a doctor, you say you're working part-time, you go to work on some days. How? I didn't know. But imagine if I wasn't engaging. If I would never still have known. So there are things that we need to, and sometimes you don't wait for them to come to you. Because I think those of us here now, we are now blessed. We need to stretch out the hand to them. And you will be burnt. Your hands will be burnt. But you don't stop. We can't say because people die in the sea, we won't drink water. Boats capsize, but we all still drink water. We need to persevere. I've never seen a revolutionary. I've never seen a change agent in all of history. I read history books a lot, that we are first loved by their people, male or female. I've never seen it. Because change is what human beings don't like. So even sometimes you're trying to advise people, pass here, look, do it this way, they'll become your enemy. They will even go and tell other people, oh, can you imagine? Chooks is very controlling, he wants to take over my life. And then you then feel bad and you withdraw. Do not, because of other people, rewrite who you are. Don't let other people paint on your canvas. Paint your own drawings. That's who you are. Keep it up.
Thank you, Loretta. Lina, your hands are up. After Lina is Fola, please.
Okay, yeah, thank you. Again, it was just really to express an opinion based on some of the things that I've heard people talk about, where, like, if I'm going to use the word, like, there's a stereotype that majority of us are faith people and that we tend to belong to churches and things. And when the pandemic came, I found myself so surprised about some of the things that were affecting the Black community. I mean, I was so surprised that so many people were dying. And then I was really so surprised that in the Black community, a lot of people didn't want to take the vaccine. And then for me, it was like, where do those ideas come from? That we're in the middle of a pandemic and people feel that some people or something is being spread amongst our community, that people don't want to do something maybe to save their lives. I mean, I don't want to go down any kind of conspiracy theory, but yeah, I just felt so surprised. And then again with the COVID, it was almost like COVID is not AIDS, but again, I felt in my community, people didn't want to tell you if they caught COVID. And I was like I said, there's a stereotype that we're quite faith-based, that we go to the church. So we kind of feel that we all know each other. And I was surprised in the middle of a pandemic, that is what was coming out of our community. Just me expressing an opinion.
Yeah, it was really sad. Because I do probably this health gospel, I talk about stuff. So I had lots of experience, not experience, personal experience, people calling me. And actually, there was a family that I was begging because the man was really short of bread. And they called me, I was begging them to please let this man go to the hospital. And the wife said, oh no, you know this, you know. I said, please, because at least let them go and check his oxygen level. I said, please. I was virtually begging on the phone. And finally, she took him to the hospital that day. They called the ambulance came in and took, because if he didn't need to go, when the paramedics arrived, they wouldn't take him, but he needed to go. So when the ambulance arrived, they took him to the hospital, and at least they gave him the needed boost he needed, and came back home. But this is a hush, 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 hush. Nobody should hear, nobody should say. I do not understand why we are hiding illness. I do not understand why. Please let me get others to speak, because I get really emotional with these sort of things. Fola, please, can you speak? Then Dr. Chooks, you speak after.
Yes, thank you very much. I'll go back to, you talking about why people don't talk about, openness about the illness they have. For me, I think the cultural impact that this had actually inbuilt in our generation is so high, because we come from a generation where when you're ill, they always tell us that not all your panties are to be laid outside. You don't put all your undies outside in the sun to lay, because your neighbors might know what color you have every day to wear. However, that is so sad that we are so inbuilt in that kind of generation that even while you want to travel out of your country, someone that came to your house 5 o'clock might not know you're packing your bag 6 o'clock to go. Mental illness, we don't talk about it. Cancer, the major one, you dare not talk about it to someone else. And there is COVID now. We need to raise a lot of awareness on it. I think more and more now we're coming out with the cancer thing. We partner with people who talk about it. But as you said, it's hard for everyone to say, oh, I've had COVID. Oh, my child had COVID. This is what I do. Unless there is a conversation that brings that kind of word out that you say, oh, well, it's not really that. I had one of my sports friend, our daughter runs as well, my girls does athletics. And 3 weeks ago, I said, oh, what about your daughter? She said, oh, she's fine. She had just flu. Oh, I said, oh, okay. Just a tiny line on the thing. I said, what thing? She said, not really, just a thin line on the lateral flow, but she will be all right because she will go to school tomorrow. Well, and I was so scared because they run together with my girls. I think my girls might have caught the COVID from our daughter. But in my mind, I just said, wow, that line that you just said, she needs to be at home. But you wouldn't believe that the girl actually went to school again. She didn't bother. So from that, I'm just going to say the impact of the cultural impact that, the what say little had on our community is so bad. And as well, again, I will talk about when Dr. I'm so sorry,
Loretta.
Dr. Loretta was talking about we have all this thing open to us, we don't utilize it or we don't use it and everything. Well, it is okay. Sometimes we will want to use it. Sometimes we will want to say this is what our problems are. But I tell you that the sectors where they would listen to you more is the sectors that you are very important to work in. Because they know that when they lose you, it's hard to find another. When you talk about our people, they work more 0 hours contracts, and you can see where what impact that really had on when this COVID started. It wasn't that easy at all, because the long-term impacts of 0 hours contracts for our individual people, or maybe Black ethnic minority, was so hard. For example, if they're talking about £500, yeah. What if you are claiming universal credit? You don't have a job at the moment, you've lost your job. Maybe someone came and gave you COVID. The person that gave you COVID is working, can claim the £500. If you call, you have 4 children you have to take care of. Definitely they are home every day and night. The money at home, you've calculated the food at home that maybe when they go to school before, it's 010 or 011. They have to eat morning, afternoon, evening when they are home. You call your council. The first thing they ask you that, you fill the form. You go online and fill it. Do you have internet? Okay, we can stay online to fill with you. What costs you most out of the £500 we can give to you is that, do you work at the moment? No, I claim universal credit. Oh, I'm sorry, we wouldn't be able to give you that because you claim universal credit. The universal credit that this family of 4 or 5 have, they're actually isolating at the moment. That will never be enough at that moment. But because they're not working, there is a clause of them not claiming the £500. So the government, in as much as they are putting more there and you feel people are not actually tapping into it, do they really care about the percentage of people that don't have the higher grounds to tap into it? And they don't have any say about it. That's all I'll say.
Yeah,
Thank
I
you
mean,
so much.
I would just say, I don't want to say too much, but that's where, if people say that politics doesn't affect us, I will say that it does. It affects everybody, the political party that you vote for, but I'm not going to say any more. Okay,
thank you, Dr. Chuks.
Yeah, I think I'm just going back to the issue of the religious bodies and, and our community. The fundamental issue is probably a lot of people are not reading their religious books. They're not reading their Bibles. They're not reading their Qurans. Because if we look at the Bible, Jesus Christ, who's the basis of Christianity, was always with the sick people. He was always there. He was always healing them. He was always touching them. And that shows that it's a significant, it is not bad, or it is not a sin to be sick. Even we can remember the issue of the man who was born blind and said, was it because of the sin of the parents? He said, no, it was just for the glory of God to be manifested. And people are taught, oh, if you are sick, that means you don't have faith. Your faith is not high. You're not a high level. And a lot of people want to attain, become pastors and things. So they get to let, if you are sick, they keep it to themselves. They don't seek for help. They don't tell it to anybody. That's one of the reasons. In addition to what everybody has been saying, you don't want the next person to know, oh, I've been sick and I've been. But the truth is, many of our pastors, many of the general overseers, they all leave Nigeria and come abroad for medical treatment. They go abroad for medical checkup. Some of them are now beginning to preach about it. But in the past, many years ago, you will never hear it. They will always tell you, oh, I've never been to the hospital all my life because of the effect I had. So you're making it look like it's bad to go to the hospital. You're making it look like it's bad to be sick. But if people were reading their Bibles well, if people were communicating with God directly, I'm sure they will see that, look, it's not wrong. Sometimes we become sick because of our lifestyle choices. You know, you eat the wrong food or you're not resting. Like we said, a lot of people are working long hours. You don't have time for rest. The body is like a car. It works and it needs time to rest. So if you don't give it that rest, it's going to shut down. It's like you driving your car, not putting a fuel in it, not putting water in it. At a point, and it's going to stop working because there's no energy for it to propel itself. So we need to also look inwards. We need to think of ourselves. We need to meditate on things. We need to seek the truth. And that's what things like this are doing. I'm not saying everybody should take everything we are saying, hook, line, and sinker. Go back. You know, there are lots of materials online. Read about it. Read about COVID. Read about the advice you're getting. Yes, we need money, but the truth is, even if you work 24 hours a day, 7 days a week, the money will never be enough because there will always be needs. The more you earn, the more your need increases. And the simple truth is, it's only if you're alive, that's when you'll be able to work. So when we say, yes, the bills are there for us to settle, we still need to consider our body. You know, there's a limit, you know, to which you can stretch your body. Going back, I remember when I first started working in the UK, I was working in the India. I could do 7 nights. I travel. I was in Manchester. I go back to Aberdeen, rest 1 or 2 days, come back again, do 7 nights. But now I can't do it because it's not, and I know it's not healthy. You feel you're strong, but at a point, your body is going to start telling you this is not the right thing. And I've known, and I've worked hard, I've earned a lot, and I've known that it is never enough. There will always be. So let's also be aware that we need to give our body the rest. You know, some days when I'm doing something, I just think of my children. I'm like, what would they be if I'm not here? If I say I'm working hard to get money and at the end of the day I'm not here, they will not remember I was working hard to get money for them. They'll remember that I wasn't there when they grew up. So let's try and pause a little bit. Let's try and, you know, let's look for a purpose in life. You know, yes, there will always be needs. Sometimes we're under pressure because our needs are not being met, but there's a limit to which we can ever push our body.
Sorry to
and
jump.
two,
Oh, okay, sorry.
yeah,
I
it's
thought
fine.
you were finished.
Yeah, and two, like I don't want us to forget about this. Is some of us, you know, I've worked in GP practices, even in areas where there are lots of BME people, we still find out that Africans are still the lowest in seeking healthcare solutions. You have the Asians, you can run a clinic and 3/4 of the patients that will come in a day will be Asians because they know these facilities are there for us. We have to use it. Some of us, we have terrible headaches and we'll still go to work because we feel, oh, it shouldn't stop us. And we're not aware that for those of us that have contract jobs, you know, that work full time, you can there are a lot of things we don't know. You can self-certify for 7 days and you still get paid. It's a legal mandatory obligation which every employer owes its employees. So if you know you're not feeling fine, I'm just saying that in case I don't remember today, it just came to my mind because there are many things out there we've been saying that there we don't know. If you are ill and you know you're not strong enough to go to work, you don't even need a doctor's letter. If you've not been off sick before, you need to call work and tell them, look, I'm not feeling fine. I'm unable to get to work. Sometimes they want to push you to get a doctor's letter. The doctor can always write back to them that they will have to pay for a doctor's letter because if it's less than 7 days, you don't need a doctor's letter. So let's not put ourselves under pressure. Let's not push ourselves too much because at a point, your body is going to break down and you'll be in hospital and that work, you end up not going to it. So I think it's, you know, COVID has taught us a lot of lessons and it would be sad if we don't learn from the lesson and, you know, and get the benefits from it so that next year we won't be saying the same thing all over again and we're not resting, we're not giving our body the rest, and we're not accessing everything available. The Caucasians know this law. Once they are ill, they call their work in the morning. I'm not feeling fine. I can't come in today. And some days, 1 or 2 days of rest is all you need and your body is back to its normal functioning level and then we can go back to work. So please seek advice, you know, if you're stranded, make use of your GPs. They are there for you. And that's why it's mandatory to register with a GP because it's free service for you. You can get the advice you need. They can signpost you to the right set of people to keep you in the right direction. Thank you.
Thank you. Thank you so much. Dr. Amma or Iro, did you want to speak?
Yeah, let her finish what she wants to say.
Okay, Dr. Ma.
Okay, just to add again to what Dr. Chooks has just said, you know, he talked about we don't read our Bibles. Apart from that, we don't even think for ourselves. We don't think any information that we want to take, it has to be the information that was given to us by somebody, by our pastors. You know, there's a saying that if you want to hide something from a Black man, put it in a book. We don't seek for knowledge. We don't seek for information for ourselves. We are relying on people to give us these messages. We are relying on WhatsApp messages. We're relying on messages, you know, that are adulterated and are untrue. And we are relying on our religious leaders to tell us what we think is the truth. We are relying on them to tell us, yes, go to the hospital. To be honest, I know lots of people who do not take medications because their doctors have told them not to go to the hospital. So we are relying on these religious leaders to do a lot of things for us, and they do not know it all. We forget that they are humans. They don't know. They are not doctors. They are preachers, except the preacher who is a doctor. Yes, of course, he's a doctor. They are preachers. They have their own field. They don't know, but we are relying on them to give us medical help. Having said that, I think these religious leaders have a role to play. They have a role to play because people depend on them for information. People depend on them for lots of things. So they have a role to play in communicating the correct messages to people, because they're the ones that are being trusted. Christians don't trust other people. They trust their religious leaders. When he says whatever, they run and do it. So that they're the ones that are trusted. Now, if information is coming from a trusted source, if reliable information is coming from a trusted source, people will take it. Let's say COVID-19 messages, vaccine messages are coming from our pastors as a trusted sources. People will take them. But these messages are not coming from the pulpits. These messages are not coming from our pastors. Rather, people are preaching, like what Dr. Chooks has said, preaching other things. There's nowhere where in the Bible where it's stated that if you take a vaccine, then you're a candidate for hellfire, or if you go to the doctors, you know. So these pastors have a role to play in cascading the right messages to people. But are they willing to do it? This is the question. Are they willing to do it? Are they willing to think outside what they know, the culture that they know? Because the culture that they know is that you shouldn't preach health because you have divine healing. You know, are they willing to learn a new message, you know, so that they can preach, they can tell people who trust them the truth? And for me, I think public health has a lot to do to integrate community leaders and religious leaders into policy, into planning, because it's not all about the doctors and the lawmakers making the rules. They will make the rules, but people will still not come and take COVID vaccine. They wouldn't. But if if public health integrates religious and community leaders, and they are hearing from doctors, from scientists, from lawmakers, from pastors, guess what? There'll be more uptake. There'll be more uptake of vaccines. There'll be more knowledge passed down to people. But people know who they want their information from. People don't want their information from scientists, because I am telling them that COVID prevalence will be so high in that area next year. They don't want to hear that, because no, I'm a prophet of doom. But this is what my software has told me. My software has told me that the prevalence will be high. You know, they don't want that. They want someone who will tell them, don't worry, go to work and you are going to get a breakthrough if you go to work. They don't want to hear me. They want to hear people that tell them these messages that have a cushioning effect on their situations. So our religious leaders have a role to play. They need to be integrated into the system so that they can also provide information, as well as the media and policymakers.
Yeah, very good.
Thank you. Iro, did you want to speak?
All right. I have just two things to say again. The first one is a question. You made mention of vitamin D initially. I was going to ask the effect of that with regards to either during COVID or after COVID, what the effect of that vitamin D you made mention of.
Go on.
Okay. And the second thing I was going to say is, just like my sister just made mention of, I think most of us, we have to separate ourselves from, although we attend religious houses, yeah, Muslim or Christian, but we have to understand that even you as a believer going to a church, the pastor says it's a pastor, but it's not a doctor. You can be more, you might have more information than him. You might be more intellectual than the pastor himself. Well, he seems to tell you, he will tell you, of course, that he is the one from God. So most of the pastors, they want to lay hands on you and thinking COVID would go. Initially, they said COVID was 5G, but now they've come to the point where they've come to realize it's not. And we collectively as Blacks, we always hold on to religious leaders, even if they are failing, we still follow them, sometimes blindly. But I'll tell you this, there were families that were not hoping rather, they were waiting, yeah, that myself and my wife would die. They were believers because they were thinking that we've taken the vaccine and very soon we'll fall down and die, or something will happen, we'll drop. They were waiting. They didn't take the vaccine. So they waited and they saw that we are still alive. And at a point, even the wife, they were telling her that she has to, if she doesn't get vaccinated, she might, her job was in jeopardy, sort of. And at the point, they were watching, but these are believers. And so it's like they were waiting for me to die, but at the same time, they were my friends or family friends and good. But this is Africa for you. You have to educate yourself and get these things done. And the second thing I was going to say about that is, if you do have a job, if you have a business, I remember during the COVID time, the government has a grant that they were giving to people who had, self-employed sort of. I have a friend who had 5K from it, another one had 10K from it. But the thing is, if Africans, they don't, sometimes there was one that collected money and he was hiding. He was hiding it. He didn't even want to even tell another friend that was self-employed. See, I don't know, sometimes we are so, just like someone was talking about, not talking about the illness, and sometimes we hold things like two secrets, two FBI kind of. We hold things in our heart, we won't talk, even when we see good things that we're supposed to share. That's why when Dr. Adi talked about the Asians, they talk, they help collectively, they help to buy houses, they help to buy properties so they can grow. But we keep, pulling one another down, and that doesn't take us anywhere, But that is just one of the things I was going to say, the awareness. We would rather prefer to stick to gossip and things that will not make us in any society to grow, rather than to stick to, things like this. How many men are here right now? Sometimes they are too macho. They think this is life. We don't know the next pandemic that might, or we don't know the next mutation that might come up from somewhere. This is a preparation for, for our life and for the future. But many men, they will just, especially Blacks, Africans, they will say, well, I beg, they rather stick to something else. But I'm so glad, for this platform and the information you guys have passed on. I'm just so grateful, and I will stick to it. Thank you so much.
Thank you. I'm sorry to interject, but what Amma said, there's something that resonated with me, and I'll just quickly say. She said that the scientist comes, the figures are gloomy. And I'm really proud of my fellow public health research, would I say, advocates and clinicians. I think what we need to understand is giving of information. Different people are trained to give information differently. And in public health, is it really recognized that there are community entry points? And that is what we are. So it is left for us to now magnify or snowball the community entry points, because there are ways you talk to our people. If a scientist came and gave very gloomy figures, they won't engage. My pastor, for one, will say, I believe in the Holy Ghost, but I've taken the 3 doses of the vaccine, because the Holy Ghost gave the people who made the vaccine the knowledge. Please go and get vaccinated. So he's just said that information in a different way. And this is why, if we know these things, we should actually tell it to some of our people too, in the religious and community bodies, because they may not know. They have a special gift as to how to actually talk to the people. We should not discountenance that. And public health recognizes that, and that's why they are called community entry points.
Thank you so much. Thank you, Dr. Loretta. Dr. Iro asked about vitamin D. I just want to quickly say before I forget that the next meeting will be on long COVID. Everything long COVID is the next meeting. So
I was just going to ask about that. If anybody talked about it before I came on, long COVID syndrome.
It is next on 19th of March, on a Saturday like this, 1 p.m., same third Saturday of the month, long COVID. That's the topic for that day. So we are going to be dealing with everything long COVID and information pertaining to long COVID, because I think if I'm right, is going to go on to one of the disability as a disability. So you can actually claim from it if you have proper information and you're attending there's long COVID clinics all over, but we're going to deal with long COVID in the next meeting. So that's just information I want to pass. So if you have people, I invite them to join our next meeting. We will have somebody who will present the whole long COVID syndrome, and then we will then ask questions and clear our doubts. So that will be the meeting for next month. I really enjoyed this meeting today because we've highlighted various things that has happened, and I want us to end at 3. I just want us to quickly talk about how has this whole pandemic, is it the same link to get in as today? Yes, I will post, it is the same ID, but it's just that you have to register. So we will post it out and you just click the link and register. It's still the same free registration. It's just for us to have our data and maybe to have a documentation. So we'll post the link out, and then maybe 2 weeks to the time, and we'll all begin to register. I want us to just quickly, can someone talk about how the whole pandemic and the whole effect of pandemic, has it affected you as a family, especially if you have young people? I remember, I think it was 2020, one of those, the middle of 2020, when they were whole lockdown and there was no school at all. And my second son, which is normally really tough and outgoing, so this day I was sleeping and I heard the bang, bang, bang on the wall, bang, 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 the night. I'm like, what's going on? So I went to his room and he was just broken. He was crying. So I took him out of the room. I brought him to I said, what's going on? He just broke down. He was in tears. He was crying. I said, what's going on? He said, I'm tired. I'm tired. I used to go to my football. I used to do this. I'm now just sitting here. I'm doing nothing. I'm tired. I'm tired. And it's just crying tears everywhere. I'm like, oh God. It was emotional. So I don't know if you had, I mean, my first daughter, she's here. She's university student. Most of them didn't go. They were at home. You have younger children. How has this affected you guys as a family? I know I have lots of this emotional stuff going on with me and my own family, my daughter, my sons. You know, I don't know about you. What has it been with you? Is there anyone that wants to share? How has this whole pandemic been with you? And then we just have 10 minutes, then we can round up. We can't hear you. Koyo is speaking, but we can't hear you. No. Can you hear her, or is it me?
No.
Can't hear you.
Is she not on mute?
No, she's not on mute. Okay, someone else can speak and then we can sort out.
Okay, I'll speak for as a doctor.
Yeah, go on, Fola.
Yeah, I'll speak for the way it affected the teenagers mostly, as it's so hard, as Dr. Loretta said, for them, because mentally I think it really affected them, because that's, going to school is the only escape route for them, and going to play football, anything. For my own kids, I think it affected them the way, it affected most kids, I would say. They couldn't do most things. But I think as now that they've had COVID twice, and I could see that in my second girl 2 weeks ago when she first tested it. And the moment I saw the trace, I said, no, you can't go to school. And you could see the fear and everything in her saying, I don't want to stay home. She was crying. So I told her to go and do the test again. God knows how she did this thing. There wasn't the trace on it. Okay. And I said, as a mother, I will do it myself. And she started crying. I just don't want to stay at home. I don't want to stay. I said, well, in as much as there is a trace, you will stay at home. So you could see the mental, what do I call it? It disturbs them mentally, because it means that they feel they can't do everything. They won't be able to do everything. It brings back the memory they had when they were at home, staying at home and all. So I had to sit down with her and say, well, it's just what we have to go through. If you're positive, you're positive. I don't care whoever it is that puts the lemon juice and need not to be positive or to be positive. As when you sit with these kids, they tell you a lot of things that their mates does not make it positive, or to make it positive, and things like that. So sometimes I think now they are so conscious of how they move with people, and health-wise as well. Now my kids will wake up in the morning, they will have lemon water, as if that's the survivor of COVID. So, I think they are more health conscious, and it brought us more closer to each other in terms of telling each other, because my second is the type that I have to force her to say things that is wrong with her, because she feels she's putting burden on me. She tells me, oh, mom, I'm sick, or I don't want you to be sick when I'm sick. So I always have to tell them that, no, you have to tell me, and that is when I can know what it is. So I think it brought us more closer as a family to talk about whatever it is, and it makes them more health conscious. And as much as I say, don't use the masks in the class, my girls still use it because they've had the COVID twice now, so they are more sensible in how they move around or what they do. So that's what I'll say.
Thank you. Nkoyo, do you want to speak? Then Dr. Ma will speak. We can't hear you. On mute. I think you need to.
Can you hear me now?
Yeah.
I'm having to log in on two systems. So, right. I'm glad you mentioned young people. You know where my heart is. I'm very passionate about young people, and I've done a lot of work around with them during the COVID, and also with women. Obviously, the first thing that was attacked when COVID came was our social life. And as it is, we have challenges already that we're going through, and having to be isolated, which is one of the biggest symptoms in depression. It was a hard one. The mention of the word isolation at the moment still freaks people out, especially young people. I have a son who was due to write GCSE, and I came home and he had his hands on his head. He was screaming, I can't write GCSE. And he was terrified because he knew how much I pushed him to prepare for his mock. And he kept telling me, Mom, don't worry, I'll be all right, I'll be all right. And I did a lot of pushing for him. And I think that scared the life out of him, that what if I wasn't pushed? Because he ended up saying, thank you, Mom, for pushing me, because it would have been a disaster for him going to college. Young people already also struggle with technology, and having to be fed by your own addiction, well, it's a nightmare for them, because they end up having to depend on technology to study, to do their coursework, to do everything. They sleep with it. It becomes, this is something most of them are already addicted to, and we struggle to manage with them at home. And having to now be the thing that is they need for survival for their studies during that period, it was a massive challenge. And working with young people had so many calls from parents that, you know, their children are really struggling, you know. So it has been a massive change in their lives. Routine went over the hill. The things they normally do, get up in the morning, have a shower, it becomes a pajama day every day, you know, a struggle to take care of themselves and all that. So it becomes really, it became really difficult. And it's still a challenge now to get back to the routine, to get themselves back into doing the things they normally do before. It's becoming a challenge because they were home every day. They don't know when weekend was, when Monday was. So it is now still a struggle, getting back there, going to school, doing all that. And I'm sure most family are going through it, even if we don't talk about it. Many of us are experiencing this with our young people. I run a young people's group. I hold brief sessions with them, 45 minutes, just to have an avenue to talk about how they're feeling. We do very fun things, asking questions, and they will answer the question without anybody knowing who's answered, because that's another thing. They don't want to talk about things that personal about themselves. So we need to make sure we think about them all the time, create a space for them, find a space for them to air out how they feel, because most of the time, especially the teens, they wouldn't want to talk. The younger ones might just come over to you all the time to want to share, drop themselves on you, but the teens, they get so isolated, and this period has been the hardest time for them. Level of anxiety has skyrocketed. You know, depression is, you don't even understand your child's mood at the moment. It's all over the place. So we need to do the very best we can in making sure that now things are starting to get back to normal. We reintroduce routine. We try and support, be more supportive of them, because they might be young, they have real struggles. Our struggle when we were younger is different from their struggle. So let's do our very best to keep going with them. Find support network for them. Check what they are doing. Show interest in how they feel. Because young people now, they just want to express how they feel. They have emotions in their bottling in. I'll stop there.
Thank you, Dr. Amma. Thank you so much, Koyo. That's from an expert point of view. You've covered a lot. I think we are all guilty as parents to just overlook over just what is this? Everybody's going to but I think the key word there for me is more focus on being more supportive instead of being on the other end. So Dr. Amma, please. And we're going to end at 3.
Okay, I'll be brief. Yeah, so really nice that we are thinking about our young people and we are including them in these discussions. It's not just about us and, you know, the older generation who are the ones that are more impacted by COVID, because we know that COVID comes, you know, you get, the older you are, the more easily you can get this infections generally. So for me, for young people, I would say they have been impacted by all these things that Sister Precious has talked about, but there's also a problem of generational gap. And what I mean is the impact that parents and culture have had on young people in the house during COVID. I think Julia said something during the last session. She was saying people of her age, I think she's about 20, 22. I think people of 18, 19, 20, 21, 22, who are grown up in this environment, you know, they think differently than us in this generation. They source for information, they think for themselves, they are free, they analyze things, they ask questions based on the environment that they are in. This environment allows for them to do these things. So they even challenge you as a parent, like when you tell them something that's from your culture and doesn't make sense to them, they will challenge you, they will ask questions, but you will be getting maybe angry at them that they're not listening to you, they're not respecting you. It's not like they're not respecting, they want to understand what you're saying because it doesn't relate to them. They are in a different environment, a different society. So they think and analyze things for themselves, unlike us in this generation. So that gap has caused problems for some young people. For example, during COVID, these are our own generation that have been damaged by lack of information. We have heard from our pastors, we have heard from other sources, and we don't want to agree that there's COVID. We don't want to do the right things. But these people, these young people that are under us, they know, they believe because they listen to news, they hear and they think, they agree, they know there's COVID, and they know that they can take the vaccines because we know they were giving 18 to 25 years, 18 years and above vaccines. They know that they want to take it, but they've got parents in these generations that do not agree with the science, that do not agree with what is happening. So this has really impacted so many children. These parents have not taken the vaccine, therefore their kids will not take these vaccines. But they know, these kids know for themselves that it's going to help them, but because of their culture, they cannot even go against their parents. And guess what? If they come down with COVID, if they get COVID, they will be sick of COVID. Some of them will end up having devastating effects. Long COVID that we're talking about. Why? Because of the impact, because of the misinformation or disinformation from their parents. You know, so we really need to be thinking about our young people. We really need to be listening to them. We really need to have a mindset that is open and free, because if we continue to dwell in that culture that has damaged us, then we're not helping ourselves. But let's not even worry about ourselves. What about these other people? What about these young people? We need to start supporting them, like Sister Precious said. We need to start listening to them, because this generational gap is really, really affecting and impacting young people.
Thank you. Thank you so much. Is there anyone that wants to add, subtract from this meeting, because we are ending in 3 minutes? Anything you want to add? Anything you want to subtract? Anything you want to advise? Anything at all? I just want to summarize that this meeting has been really, really, really useful, impactful. We all can agree that we've learned so much today. Even myself, I've learned so much today. We've talked about our challenges. We've talked about information. We've talked about being open-minded. And when we talk about being open-minded, you don't have to go in front of your street and use a speaker and announce your problem, but being able to seek information from right people around you, being able to be open to someone, to people around you. And we've talked about integration, being able to integrate into the society that you live in. A lot of us are in this society, but we are living as if we are in our villages. A lot of us are in the UK, but the lifestyle and everything of yours is your village lifestyle. Why don't you just pack your bags and go back and stay there? Because sometimes the children will say, but I'm not in the village, I'm not in Africa. You know, we have those conflicts because they will tell you, but this is not Africa, meaning you are living the life you grew up in, the society you find yourself. We are not able to integrate. You go to Monday to Friday, you are in the workplace, you don't communicate with the people in the workplace with you because they're not of your skin color. That on its own is racism. I say it anywhere. You don't communicate. Like Dr. Loretta said, they offer you a cup of tea, you say, no, thank you, because you don't like tea. When I came to this country myself, I didn't like, now I drink 4, 5, 6 cups of tea every day. As they offer me, I'm drinking, I don't have time. you know, and she's right. You get lots of, you get friendship, because you sometimes I've noticed that when you go into workplace at the first time, you feel that they don't like you because they are sort of inhibited, and you are inhibited too. But no, they just want an avenue where they can communicate and talk with you. You want to integrate, you want to be open-minded. We go to one, we talk about stuff. They talk about their cats and their dogs. Please be interested in their cats and their dogs. Ask them they have their names. If you don't like pets, be interested. That is the only way to integrate. Get access to your GP, use them, use the GP, call the surgery, get access to information at work, compare whether 0 hours, because we are talking about the impact and the effect of COVID. Compare whether 0 hours or having an actual contract, which one is more beneficial. Actually sit down by yourself with your own circumstance and know which one is good for me, not what everybody else is doing. This is one thing I always say to people. Why do we come here? I'll give an example. This is a very funny example. Like the hard chicken, like, you know, our people will say, it's hard chicken. Everybody's talking about hard chicken. And I said, I can't eat it. I don't like it because for me, there's nothing in this hard chicken. It's just to cook it and waste your time and cook and cook and cook. But if I buy the normal chicken, there's a lot of flesh there. I can eat it. It's juicy. So everybody's hard chicken. Who brought about this idea that I have to eat this hard chicken to be African? This is the mindset that we have to change. You have to do what works for you in this country, not what everybody else is doing. And when it comes to illness, we've got to be open. We've got to talk to people. We have professionals like here, get their numbers. They are open. We talk to one another. You call for advice. They might tell you, go and call your GP or something, you know, and try to be more open. Let's try to work on our minds that it is intentional. I know it's difficult, but it is intentional. We can change. We can make a difference. We can work together. There are challenges, but if we work together, we can overcome these small challenges and at least face the bigger ones. So thank you so much, guys, for today. The next topic is long COVID. I'm telling you, we all need to know about long COVID, because even what you're going through now, you may not even know that it is long COVID. You know, you have this COVID, you've come out of it, or somebody you know, and you don't know what they are suffering is long COVID. So we need to all come next month, 3rd Saturday, we will be dealing with long COVID. Thank you so much, everyone, for joining today. And I really, really appreciate you all. Thank you so much, and bye for now.
Thank you too. Bye-bye.
Bye.
Bye.
Thank you.
Bye.
Bye.
Heidi, can you stand for a few minutes, please?
Okay.
Bye, everyone.
What happened? What happened to the recording?
It says it's still recording.
Okay, let me end it.